Well, joining me now live is former British Prime Minister Gordon Brown, who's now serving as the World Health Organization's ambassador for global health financing. Good to have you with us.
Hello, Linda. It's good to talk to you.
Certainly plenty to discuss today, but I want to start first on your comments regarding your criticism of the current UK Prime Minister over his response to the COVID crisis. You say his advisors should sit Boris Johnson down and acquaint him with some basic medical facts. From your perspective, where is he failing?
Well, the problem in Africa, he says, is low take-up because people are resistant to taking up the vaccinations. But the real problem, the bigger problem, is the lack of supply of vaccines. And as I think you've been saying with your figures, only 3% of low-income countries have been fully vaccinated. Only 7% in Africa have been fully vaccinated. We set a target of 10% to be vaccinated by the end of September, and we failed. We've got a target of 40% by the end of the year, and we're not likely to succeed in that. So what we've got to do is speed up the flow of vaccines from the countries which have stockpiled them to the countries which need them. And we've got to do that for another reason. There is a danger that millions of vaccines that are lying in the West are going to be wasted because they're going to pass their use-by date and they're going to expire. So nobody wants to see waste. Let's get these vaccines out to the people who need them as quickly as possible. And then we might be able to stop the spread of the disease and stop new variants emerging.
You make some very good points there. And Mr. Brown, I just want to point out that according to the WHO, only 1 in 4 healthcare workers in Africa, those on the front line, are vaccinated. Do you find it baffling that almost 2 years into this global pandemic, most wealthy countries are still treating this like a national issue, shutting down borders, imposing travel restrictions and hoarding vaccines? And as you rightly point out, millions of vaccines are set to expire by the end of this year.
So these are millions of health workers who are risking their lives to save lives. But we've got a vaccine, it's available, but we haven't got it to them. Now that's a failure of coordination. And what happened at the outset was that the G20 countries, the richest countries, overordered and have oversupplied with vaccines, and they've been too slow to release them. So America promised that it would give 1 billion vaccines to the poorest countries, but the vaccines are needed now, and only 25% of that order has been met. In Britain's case, it's only 11%, European Union 19%. So we should be getting the vaccines out far more quickly. We are producing 1.5 billion vaccines a month, so there is supply. We're just not distributing it fairly enough. And the problem is it comes back to haunt us. Because if these diseases spread with new variants, they will come back to bite all of us, even the fully vaccinated in the West. And that's why we've got to act, not just to get the vaccines out, but to get them out urgently so we can prevent more people seeing the disease spread in their countries.
Exactly. This pandemic will long continue, but in the interim, many countries like South Africa and like some of the neighbouring countries are on this red list, banned from travelling to other countries like the UK. But 89% of people there remain unvaccinated, and no doubt these bans are going to hurt their local economies as well.
Well, they're depending a lot on the recovery of tourism. But you can understand that countries are reluctant to have people coming in and out where they know that the variant is spreading. And the real answer to that is to say, look, if we're going to have a ban on travel, we're going to help you also to give you the vaccines that will allow you to be able to be free of this virus as soon as possible. The World Health Organization is predicting, I'm afraid, that there will be 200 million more cases in the next year. So we've had 260 million. We think we're on a downward slide in the West, but actually we're only just over halfway through this if there are to be 200 million more cases. So we've got to act more quickly. We've had 5 million deaths already. There is a prediction there could be 5 million more deaths. Now, to avoid that, we need vaccination. We also need testing, by the way, and most of the testing is being done in the richest countries and very little in the poorest countries. So it's very difficult to pick up and to detect the disease if you don't have testing equipment to know who has been infected and who has not been infected. We've got to do more, not only on vaccines, but on testing equipment too.
Yeah, that's a very good point. We need to know where these new variants are emerging. I also want to ask you about the WHO. This week, agreeing to draft a convention or an agreement to improve how the world responds to pandemics in the future. What is that likely to include, and how could that help future generations?
We've really got to do this because we've learned so many lessons from our failure to coordinate and to work closely together. And we've had vaccine nationalism, medical protectionism, and we've really got to recognize that nobody's safe till everybody's safe. So first of all, we need to have a better early warning systems. We know that we were too slow in getting action, both in the country, China, where it started, but also around the world. And we need a flow of information that really didn't happen quickly enough. Secondly, we need to have reserves of supplies. We were too slow to get the ventilators, to get the equipment to countries that were in desperate short supply, and we could build up reserves. And thirdly, we need to fund the global preparedness so that we can prevent future pandemics. And we've yet to get an agreement on the fair sharing of the costs so that there can be global action immediately whenever there's a crisis. It's too late sometimes. When you go around with a begging bowl a few months later, you really should have the funding available to get things done immediately. So what I call a pandemic non-proliferation treaty to stop the proliferation of pandemics is something that is really urgently needed if we're to be better prepared than we were in the past.
Absolutely. Gordon Brown, former British Prime Minister and the WHO Ambassador for Global Health Financing. A pleasure having you on the show. Thank you very much.
Lynda, thank you.